Bismillah ar-Rahman ar-Rahim. Today's lecture is titled Surgical Ethics. Your lecturer today is Associate Professor Dr. Hatem Alwagih, Endocrine Surgery Unit, Surgery Department, University of Alexandria. The learning outcomes of today's lecture are: number one, we need to define ethics. Number two, to specify different issues in surgical issues. And number three, define autonomy, informed consent, and confidentiality. Number four, understand the important ethical considerations of surgical research and surgical practice. The word ethics is derived from the Greek word ethos, which means character. To put it formally, ethics is the branch of philosophy that defines what's good for the individual and for society, and establishes the nature of obligations or duties that people owe themselves and one another. Regarding history of ethics, the famous Greek healers in the 4th century BC drafted the Hippocratic Oath and pledged to prescribe regimens for the good of my patients according to my ability and my judgment, and never do harm to anyone. Ethics and surgery. Ethics is an essential discipline in the practice of surgery, and it represents our best understanding of moral responsibility. It evolves as reasoned reflection on clinical experience, and the role of surgeon is to act as the patient's fiduciary. Ethical study investigates what should be our character and conduct. Morality is subject to re-examination and improvement, and the ideas of justice and fairness require critical assessment and improvement. And ethical arguments should maintain relevance. Those are the basic principles of medical ethics in general, in all fields of medicine, not only in surgical practice. 4 main principles. Number 1, autonomy. Number 2, beneficence. Number 3, non-maleficence. And number 4, justice. What's meant by autonomy? We need to know that the patient has freedom of thought, intention, and action when making decisions regarding healthcare procedures and their own management. The patient must be informed. He has or she has the whole right to be informed of the consequences of surgery that may affect him adversely. Second concept, second main pillar of surgical ethics or ethics in general is beneficence. The surgeon should act in the best interest of the patient. You need to act as in the best interest of your patient. Surgeons rely on technology. We all know that. That's the era of using technology in surgery. From diathermy to control bleeding to the operating room light. The conscientious surgeon should thus ensure that the equipments are functioning and reliable. Why? Because faulty equipment compromises patient care and increases the likelihood of surgical complications. The third pillar of medical ethics is non-maleficence. The famous rule, we need to concentrate here. The famous rule or the famous fundamental of medical practice is this rule: we need to do no harm. We need to make sure that the procedure does not harm the patient or others in the society. The fourth pillar of medical ethics is justice. Why we need justice, why we need to consider justice while practicing medicine, because the distribution of scarce health resources and the decision of who gets what treatment is very important, especially in the era of scarce health resources. The four main areas that surgeon must consider when evaluating justice are: number one, fair distribution of scarce resources; number two, the competing needs of patients; number three, the rights of patients and obligations of the surgeon; number four, potential conflicts with established legislations. We need to focus here on issues related to surgical practice, ethical issues related to surgical practice. Again, autonomy, the process of informed consent, and the difficulties that face the surgeon and the patient while taking informed consent from the patient. Number three, confidentiality. Number four, ethical considerations of surgical research. Number five, the excellent standards, surgical consideration while trying to practice with excellent standards. Autonomy, again, we need to respect the autonomy of patients and their ability to make decisions and choices about their treatments and treatment plans. It recognizes the concept of autonomy, it recognizes the rights of the patient to self-determination. So patients have all rights to make choices over their surgical care or the surgical plan of treatment. And we need to respect for autonomy, and we need to respect, the respect for autonomy is the basis of informed consent. So, what about informed consent and the difficulties that face all medical practitioners, especially surgeons, while taking informed consent from the patients? Individuals are entitled to all the available medical information and are allowed to make autonomous decisions related to their health care. So what are those information that you need to provide your patients? You need to explain to the patient what about his own health problem. We need explanation, the patient needs explanation of his own disease. You need to explain the untreated natural history of the disease. What if, like, he might ask you, what if I'm not, I made a decision not to follow you or to follow the proposed plan of treatment? What is the natural history of my disease? Number three, you need to recommend the most appropriate surgical procedure according to the best knowledge, to your best knowledge. Number four, discussion about the risks and benefits of the surgical treatment plan. Number five, what about the anticipated outcome of the surgical procedure? What about the prognosis of the disease? And lastly, and one of the most important fundamental information that you need to provide your patient with is, what about other treatment alternatives? Is there any other treatment alternatives? You need not to stick to one alternative. Your patient might ask you, is there any other alternatives? You need to be honest, you need to be clear, you need to tell him about all other treatment alternatives and the possible risks and benefits of other alternatives. We need to help him to get and to make his own decision. Those are the principles that we need to consider while taking the informed consent of the patient. Number one, you need to ensure that the venue is calm and it's a quiet place. He needs to hear you, right? Yeah, your patient needs to hear you. Number two, the consent form itself, the form that the patient will sign later. It should be written in the patient's language so he can read it. Number three, you need to pay time and provide patient enough time to take his own decision. Number four, informed consent should be given in the presence of the principal person or the surgeon, the principal surgeon, not one of his assistants, not one of other members of the team. The main surgeon, the principal person of the treatment plan. The main surgeon should be there. Number 4, you need to record this informed consent in the database. And so you need to enter this informed consent in whatever mean. You need to keep it in a safe place, whether electronic or maybe paper-based or whatever. But you need to keep it, case record. We need to take attention here. The information that you provide your patient with should be accurate and reasonably complete. You need to avoid technical language. You need not to use medical terms all the time while talking to your patient. Number 3, if the patient cannot speak your own language, you need to provide translator for him. Number 4, you need to clarify patient's doubts about maybe your ability to do his procedure, the procedure that you tell him that you will do for him, and doubts regarding the natural history of his disease, the prognosis of his disease, as we mentioned before. All right? What are the difficulties? Then we jump to the difficulties that during practice you might face while taking the informed consent from your patient. Sometimes you might be faced with refusal or waiver by the patient. He will not accept the procedure or the treatment plan that you provide him with. The temporary unconscious patient, a patient who is unconscious, how you deal with him. His legal representative should be there, right? Children less than 18 years are minors and are legally incompetent. They cannot make their own decisions. And other incompetencies, like the insane patients, patients with special needs. So you need to consider this while taking informed consent. Here is one of the most sensitive issues regarding medical practice in general, and we face them. We face this issue very, very much during the last decade or 2 decades, maybe, the end of life issues. In the unusual circumstances close to this, that no evidence shows that a specific treatment desired by the patient will provide any benefit from any perspective, the physician need not to provide such treatment under whatever circumstances. You cannot respond to the pressure paid by the patient himself or the relatives under any circumstances. You need to follow the scientific plan or the plan that you determined. I don't mean that you need to be very tough, but you need to think scientifically and implement the most correct treatment plan. Number 2, if there are no treatment option, that's to say, for example, if the patient is brain dead and the family insists on treatment, and if there is nothing that you can do, treatment must stop. This should be noted in case sheet along with senior clinician's agreement. Here, this is one of the very important surgical ethical consideration in surgical practice, the confidentiality. Well, the principle of confidentiality is that the information a patient reveals to you as a surgeon is private. This information is private and has limits. He revealed it to you, but it has limits on how and when it can be disclosed to a third party. The patient and the surgeon, who is the person treating the patient, both of you have dignity, both of you. When can you break confidentiality? If the patient is threat to self or others, so you need to get help from other medical team members, right? So you need to break the confidentiality. Number two, to other team members to improve treatment options, other members of other specialties. You are a surgeon, you need to break the confidentiality. It goes without saying. To the radiologist, you need to provide the radiologist, the pathologist, whoever, the clinical oncologist, with the patient's information. Here, of course, you can break confidentiality. Number three, for public interest. And of course, under court orders. Well, here, we will talk about the surgical ethical considerations in surgical research. Well, surgeons have a subsidiary responsibility to improve operative techniques through research. This is all the time. It happens all the time. We need to improve operative techniques. Why? To assure their patients that the care proposed is the best care. So you need to improve operative technique all the time via research to ensure the public and your patients and the community and the society that the care that you provide is the best care. The administration of such regulation is through research ethical committees, and surgeons should not participate in research that has not been approved by such bodies. So not only the surgeons, of course, all medical team members, all medical practitioners, you should not participate in any form of research without prior approval of ethical committees. All right. And here we'll talk about the ethical considerations while trying to provide your patients with the excellent standards of care. We need to optimize success in protecting life and health to an acceptable standard. Surgeons must only offer specialized treatment in which they have been properly trained. It goes without saying that you need to get training, proper training, before you try to practice surgery. To do so, it will entail sustained further education, lifelong education, through a surgeon's career in the wake of new surgical procedures. To do otherwise would be to place the interest of surgeon above that of their patient, an imbalance that's never morally or professionally accepted. So you need not to put your own interest above your patient's interest. So your patient's interest comes first. And this is one of the best famous sayings that I can finish my lecture with, that the fundamental contract in surgery is an undertaking by one individual to cure another by operation in the expectation of reward. And the reward is patient's cure. Here's my reference, Brilliant Love's Short Practice of Surgery. Thank you so much.